Hey guys, this is Coach Megan from Gym Guys Richmond, and this is our coach Sarah. And today we are going to be talking about a recovery technique called scraping. Now, Sarah is a certified practitioner in scraping. So today I'm going to ask her some questions. We're going to do some demonstrations and show you guys kind of what it is, why it works, and any other kind of things. So we start here. So first up, what is scraping?
So scraping is really helpful to help. Scraping is really good to help with muscle recovery after a workout, decreased pain, swelling. It has a lot of different effects.
Okay, awesome. Now, who would really benefit from scraping?
Pretty much anyone. Anytime you feel any soreness or think you have some pain going on, any swelling, scraping can help you out.
Okay. And what is it? How do you do it? That kind of thing.
So you use this tool right here. It's usually metal, always metal. And you also need a little bit of lotion, like a massage cream or coconut oil works well too. And you just apply it to the muscle or wherever you're feeling some soreness. And there are different strokes that have different purposes, and you can go through some of those.
Awesome. Yeah, so we're going to go through some of them. Sarah's going to demonstrate on me to kind of show you guys a better idea of what it would kind of look like. Some of the techniques, Sarah's going to kind of talk through those, and I'll tell you how it feels kind of as we go along.
Yeah. So you want to get a little bit of lotion on and put it on. And when you're first starting, it's not much lotion. You don't need that much because it should be, it shouldn't soak into the skin. That's the kind of lotion that you're going for. When you first start, you want to start with the bevel side down. And that's a good way to get an idea of the quality of the muscle there. If you feel some bumping, you're in an area where you have some knots, and that's a good area to focus on. Right now, I don't feel many bumps, do you?
No, I really don't. Yeah. My forearm's doing okay.
Yeah, no problems there. We can try your other side. Sometimes that gets, the other side of your forearm,
arm.
Sometimes that gets irritated too.
Yes.
Especially when we grip a lot. So, let's see how this is doing. And you always want to go from out to in for most techniques. I'll explain any other exceptions to that rule, but otherwise we're going to focus on out to in. So here we're a little bumpier.
Yeah.
Right? Yeah. So now I notice up here she's a little more bumpy than far down here. So that's when you turn your tool over, and now you're going to work bevel side up. So I'm going to go a little harder here, and
My arm feels a little like gravel right now.
yeah, it really does. It's bouncing up this arm. And sometimes, I don't know if you can see on her, but she is getting a little red. That's totally normal. That just means your muscle needed the blood flow to that area. You got some stuff going on, and we're going to stimulate the blood flow to get those toxins out. Toxins usually like lactic acid, stuff like that, things that build up after a workout. How you feeling?
Yeah, I feel good. My arm's a little red right now, and when she was going through, I felt some pressure, but really that was it. Kind of like a massage therapist if they're doing a little bit deep tissue and just kind of getting in there, but it wasn't painful, just really it's more pressure than anything else.
Yes, pain does not indicate success for this treatment, and you should focus on an area 30 to 60 seconds, 90 seconds max.
So what parts of the body can you use this on? Is there any particular body parts you should specifically use it on or not use it on?
You can use it almost anywhere. I would say staying away from the front of your neck is a generally good idea because we have some important arteries that go there. So we want to keep those flowing.
Now, what are some of the other sides that you can use on this tool, and what are they used for?
So most of the time we use just the normal treatment edge because we're going for breaking up knots and just mobilizing fascia, which is what is between your skin and your muscles. So when we move that around, it allows things to flow a little better, muscle fibers to move smoother. But sometimes, I'm sure as everybody has experienced, we get irritated at certain points, and that's typically referred to as tendonitis. So that's when these rounded edges come in handy. And if you don't mind, you can practice on one of your potentially tender areas. And for this one, you usually go right around. You can feel like that bony prominence on the side of your arm. That's where all those muscles in your forearm attach to. One on this side and the other side. So those two bony points are the spots that I would focus on for the elbow. Those are where your flexors and extensors attach, and that all of them attach at these spots. So it can get pretty irritated. And you're just going to put the curved side down. Ideally, it has a double bevel, which means it's curved on both sides. So that way you can rock it back and forth. If it doesn't have a double bevel, you have to pick it up or just not put pressure when you're going back to the starting position. But since this is a double bevel, I can just get right in here on her insertion point and kind of just...
So she's really just kind of rocking back and forth.
How are you feeling?
Right around the elbow. Yeah. Okay. Once again, a little bit of pressure, but I mean, no pain or anything like that. Definitely feel a little tightness in there.
Yeah, it's tight. And sometimes when this guy comes in handy, when you're really getting irritated at a certain point, you can kind of come in here and be a lot more focused and just get around the bony part and scrape away just in any direction and kind of move things around if they're getting stuck at that point specifically.
So is this mostly blood flow related? Is it tissue, muscle?
So when we're doing focused treatments like that, it's usually to kind of reorganize the tissues there. A lot of times when we get irritations like that, it's from overuse, and when our bodies are trying to heal, we're still using it and it doesn't heal correctly. So the point of getting in there with this with this tool and digging around like that is to kind of reorganize some of the tissue and help it heal in a more aligned position.
Okay, awesome. Now, is there anyone or any particular place you really shouldn't use this?
People who should not scrape. Anytime you have a localized infection, so just don't do that, okay? Over the infection.
Okay.
Anytime you have a bruise, don't do it over the bruise. So if you get a bruise as a result from scraping, which is totally normal, it should resolve within 1 to 3 days, and then you can scrape in that area again when it's gone. Otherwise, and if you don't know what these are, you're probably good, okay? Myositis ossificans, don't do it over an area with that. If you have osteomyelitis, thrombophlebitis, an open wound, inflammatory skin condition, you don't want to do it. It's not going to react well. You want to be careful if scraping makes things worse. Not a good sign.
Okay.
If you are on anticoagulants, so any blood thinners, be careful because obviously this increases blood flow. And if your blood is really flowing, you might want to be careful. If you have varicose veins, you don't want to do it over those. Diabetes, you want to be careful if you're having sensation issues in your feet or something. Just be careful with how hard you go. Autoimmune disorders, during a flare-up, not the best idea because usually during a flare-up we have a lot of inflammation going on and this increases blood flow. So we wouldn't want to you already have a lot of fluid mobilization going on when you're in a flare-up, so you don't want to make that worse. If you have chronic regional pain syndrome, again, if you don't know what that is, no big deal. Any surgical incisions that aren't fully healed, you don't want to do it over those. Once they are healed though, like say you get a knee replacement and they are fully healed, you can feel free to go back and forth on that scar, and that really, again, it helps reorganize the tissue and heal scars too. Even if you have old scars, you can do it over it, and that'll help. It actually helps heal the scar and make it go away a little bit. So
wow, great.
Yeah, and then any condition where you just have softened tissue or a weakened skin integrity. Maybe some older adults have weak skin integrity, so scraping too hard wouldn't be a great idea.
Okay, well, perfect. Well, awesome. Well, that's all we got for you guys today. I hope you watch our whole video here, and please comment with any questions that you may have.